Chronic laryngitis. Laryngitis, according to duration, divided into two parts: acute laryngitis and chronic laryngitis. Acute laryngitis mainly persists 3 to 5 days and it is self resolving. And main causes are mainly viral or bacterial infection. While the chronic laryngitis persists more than 3 weeks and there is inflammation of mucosa and submucosa, which persist beyond 3 weeks. Chronic laryngitis is a chronic inflammation of the laryngeal structure, most commonly affecting the laryngeal mucosa and to a certain extent affecting the submucosa. The chronic inflammation process can be due to either to infection or non-infectious causes, with a broad spectrum of etiology which may act singly or in combination. Main etiology factors are smoking, voice abuse, and reflex. Clinically, chronic laryngitis may be non-specific chronic laryngitis or chronic specific laryngitis. Non-specific may be chronic simple laryngitis, hyperkeratosis, pachydermia, contact and atrophic laryngitis. While chronic specific may be tuberculosis, syphilis, grilloma, mycosis, vaginal granulomatosis, and leprosy induced chronic specific laryngitis. Key symptom associated with chronic laryngitis is alteration in voice quality in the form of hoarseness. Associated symptom may be sensation of foreign body in the pharynx, pain, sore throat, and chronic cough are another associated symptoms. The main etiological factor of chronic laryngitis like smoking, reflux, patient occupation, social activities, allergies, and coexisting disease may be post radiation, neck malignancy, immunosuppressive state on chronic corticosteroid topical therapy may be main etiological factors. So you should rule out according to this. For reflex, you should do pH monitoring, upper GI endoscopy, smoking history, and how much smoking is there. Patient occupational exposure, that is chronic like factory workers, allergies like upper and lower GI, and respiratory allergies, and coexisting disease like radiation for malignancy should be ruled out for chronic laryngitis. Acid reflux mainly lead to damage of the posterior laryngeal mucosa leading to mucositis which lead to chronic throat clearing and cough which further damage the laryngeal mucosa which lead to laryngeal inflammation. So this laryngeal reflex is mainly lead to mucosal inflammation which somewhat extend to submucosa. Fees and Kaufman grading of chronic laryngitis. First grade is red erythroid with mild inflammation. Second grade is diffuse edema with diffuse inflammation. Third grade is diffuse edema with granuloma formation. Fourth grade is discrete granuloma are there on the laryngeal mucosa. So these are the graded of by the Fees and Kaufman to classify the chronic laryngitis. Some cases of chronic laryngitis required endoscopic assessment under GA, like any area of larynx which might be considered suspicious for dysplasia or malignancy. Second may be coexistence pathology such as buccal cord polyp cyst which required surgical management. Third, there is inability to see the larynx like OSMF. Or fourth may be failure of medical treatment. Then you can examine the larynx under general anesthesia. So treatment is mainly addressing the underlying causes sometimes required empirical treatment with PPI, supplementation with alginate, voice therapy, systemic corticosteroid therapy, and stopping of smoking and lifestyle modification are the treatment for chronic laryngitis.